There's a lot of misconceptions online about physical therapy. Today, we're gonna dive into videos online about physical therapy and let you guys know about our thoughts and experience. Let's get into it.
What did you do? Where did you wake up? Or who did you hang out with? If you were to hang out with someone, who were they?
Yeah, that's pretty true. At the end of the day, if you talk with all these patients, clients, you start gibbering your words, start asking like, wait, did I ask that question to that patient already, or was that another person that I asked that same question to? Your brain's mush at the end of the day, especially in the beginning, and you're trying to learn everything and how to treat people. So remember that being like sort of exhausted and brain dead, but then you still have to be on for your patient, but then your mind's elsewhere on either trying to get the notes done for insurance, or you want to get out on time and there's still a patient in the clinic. I've been there. I mean, I'm sure my physical therapist, I think every therapist has been there, where you start asking like, that question made no sense. Hold on, let me bring it back and re-ask it, and then your brain turns on a little bit. Yes. It's good to start seeing money come in after shelling out all that money towards physical therapy school, so you do get a little excited. Oh, finally, I get paid. But then you look at your student loans and all the other bills you have to pay, and there's not much left afterwards. So as fast as it came in, that first check, it came out faster. It went out faster. In physical therapy school, you're also working in clinic at the end, and you're not getting paid for it, and you're doing all this work, and then when you first get that paycheck, you're like, all right, cool, I'm like, cool, it's worth it. But then student loan payments start to go out, and it starts to go out just as fast as it comes in. There's different stages. So that's advanced, like end stage, rehab, which is actually the fun part when you're like bringing someone back to sport and you're doing all these, fun exercises. In the beginning, it's going to be slow. So you do need that hands-on work to help promote healing, but you'll see as you start to heal, the fun stuff comes at the end. It depends on the clinic that you're at, but to have every patient that's going to look like that, no way. Are you kidding me? Like, you may have one person in the clinic in your day or your schedule, maybe two, that look like that. Everything else it's much more slow. I mean, that's why, I think physical therapists, when they get an athlete on their schedule, they're like, yes. Like, no offense to the older patient, you're not doing crazy deadlifts. I mean, maybe you are, depending on where they are, but your clientele really dictates that type of care. Yeah, total knees, total hips, maybe like microdiscectomies. It's not looking like that, especially not in the beginning. Different ages definitely call for different exercises. Not that you can't do something like that with someone in their 40s, but you're definitely a little bit more cautious. As a therapist, you're more relaxed. Like, I know you can do it, versus someone that's older, like, actually, maybe let's start with a squat jump and then move to that exercise. Yeah, I think as a person, like, speaking of age, as you've gotten older, you do get more conservative. You have this like Superman complex, and that eventually goes away. And sometimes the activity or what caused the injury doesn't match with the injury, like how it happens. Oh, I was just doing this and it went, and you think about, in your 20s or even teenage years, you do things 10 times worse and wake up like, yeah, I'm fine. Dust yourself off, not even killed the next day. So very accurate. Yeah, sometimes it goes like that. Most of the time, it's a lot more of a process that you kind of get through, and you can get some pain relief, but it's not a one and done like many people expect when they come in, at least their first visit. When you do treat somebody with one session and their pain goes away, it does feel good, but I always tell people that doesn't always happen. I enjoy it, but it's a rarity. Seemed like something I would want right now. Yeah, I'll loosen up. It's not how I would do it, but it's cool to see other techniques. The tools are getting really popular as well. And you can see some blood flow coming to the area there. But yeah, if it's working, it's working. I would take some of that right now. Yeah, that's sure working all day. There's a lot of techniques, right? So many of them work. You find something that works for you, and if it works, great. You know what that guy needs right now? What? Muscle therapy, of course.
Like that?
No, just my right lat underneath.
Okay. And then you're gonna feel it too. Ease overhead. Too much, let me know, okay?
I mean, that's a cool table. I feel like there's a new thing that's coming out. I love that you can change the position and work the muscles in different ways, and the patients being an active, part of the treatment that we're big fans of. It's just changing the position, making sure that the patient is an active participant in the treatment. That's going to really make that treatment really effective. So I thought it was a really great treatment.
Yeah, it's a pretty, I mean, that guy's doing a great job treatment-wise. That's probably what I would expect if I was going in and wanting treatment. Obviously, there's not, every therapist is not going to treat that way. Every place you go is not going to have that kind of experience. But table's good. I like it. I think it was really interesting because you can kind of get like a, pin and stretch. But I would like the person being active if they can. I could see that better for someone maybe a little less mobile or a little bit more hesitant, but someone who can actively move and doesn't really have any pain and is not restricted. I would have him or the person on the table doing the movement to kind of stretch out or go into a child's pose position. But overall, that's a great treatment.
That happens at least once a day.
Yeah.
I'm like, all right, lie on your back, face up. And they go right into the stomach. And there's always like a little bit of a delay. Like, oh, wait, you said on your back.
I don't know if it's a pressure thing, but yeah, I said the same thing. Lie on your back, face up. So I try to give him like 2 cues. Like, okay, if I didn't hear the first one, okay, face up. Okay, I gotta look up. Without fail, it's always that.
Once a day. Once a day.
And if I say lie on your stomach, he goes the opposite way. I don't know if it's just a pressure. They want to get it right. So you think about doing the exercises correctly. Sometimes even getting on the table is the instructional thing that you have to get right. So
Patient is admitted with COVID, COPD, a broken neck, broken ribs, 1 leg, and 17 toes. Patient is actively coding. What's the first step of the nurse?
Chest compressions?
No! Wash your hands.
Yeah, I mean, that definitely is like PT school with the crazy scenarios. And I understand what the teacher's trying to do. It's trying to get you to really think. And it's not going to be always cookie cutter like, oh, yeah, someone has, a knee pain. It's like, no, there's going to be other factors. Every person that comes onto your table is going to be completely different. So that's why you shouldn't have just a cookie cutter same treatment for everybody because everyone is different.
yeah, not everything's going to be textbook. So you make it, trying to make it textbook. And it didn't work when I applied it to real life because there's so many other factors. But it does prepare you for the boards that ask questions very similar to that. So you need to make it complex. As funny and annoying as it actually is helpful to pass the boards. It's actually helpful to be a physical therapist and start thinking, well, what else could be going on, not just knee pain walking in.
Jehovah's Witness, believe it or not. He went from Catholic to Jehovah. So basically, my grandmother wanted us all to switch from Catholic to Jehovah. Meanwhile, we're from Harlem.
You get some crazy conversations, but it actually makes sessions fun and keeps it going. And I like when patients are talking and interactive, no matter how crazy the stories are. I feel like more now, because we see our clients more consistently, you don't get too much of that. Like you get to know them, and really inspiring conversations or really informative ones. But when I first started out, I felt like I got a lot more of those kind of client sessions, but they make for good stories when you're outside.
If they feel comfortable with you, it's actually like a good sign that they will tell you some things that they wouldn't tell other people. It means that you're creating that safe environment as a therapist, and that's what's going to help your results as well.
Je
m'appelle.
Je m'appelle.
Mais poupou.
I know in my sessions, when I'm teaching a client exercises, I repeat myself so many times so they hear it in different ways. So when they go home and they're by themselves, that they remember something that I said, like, oh, engage my glute, and then they do it themselves. But very accurate. I think it's funny.
You want to make sure the client can hear you when they have to do it at home if they're doing the exercises. I mean, you want to challenge them too, so that there's got to be a little bit of, oh, I didn't do it right. But I think it's actually very, very accurate. But when they go and do it at home, like, oh yeah, fight your knee out, or he said something like that, or he said, think about, holding something like in between your elbow or something like that when I'm doing like a bicep curl, something of a cue. But it's the first time. If you're teaching them something new, I don't expect everyone to get something the first time. So this takes practice. therapists they need treatment too. We're not perfect. I know we're teaching it, but you know, we get injured, we're active, and there's things that we need to do for prevention or rehab as well. There's some hard training days, or for me, marathon training, I'm sore. Yeah, the demonstrator squat looks a little rickety. So
Yeah, we're lucky we have each other to give us each other treatment. But yeah, definitely have those days where, you know, you get nicked up and you're like, man, I really shouldn't be doing this lunge right now because, you know, my knee is bothering me, but I'm going to show it off anyway. I mean, therapists, yeah, we need to take care of each other, you know. We hope this video gave you some insight on the world of physical therapy. If you guys would like to learn more about the type of physical therapy we do, aka muscle therapy, check out our other videos on the channel.
be sure to check those videos out.
We'll see you in the next one.